I think practicing physicians can make a big difference with patients. We know this from smoking cessation. When it's identified as a medical problem and when it is repetitively pointed out, A, it's a medical problem, B, I'm available to help you, C, there are smoking quit aids. We can do the same thing with nutrition. We can do the same thing with physical activity. Physicians currently often are not adequately educated to know how to say that, even though they learned how to do the smoking cessation mantra. So that's something that we do need to emphasize more. And the other thing to say about it is that physicians currently are not paid to do that. And yet there are provisions in the ACA, our Affordable Care Act, that will reward and actually pay for prevention. So we have that to look forward to. It's a good time. The diet drugs predominantly have been found to be unsafe, or when approved by the FDA have so many black box warnings around them. Can't use it in hypertensive, can't use it in this, can't use it in that. You typically really basically can't use it in anyone that you had a medical concern about the impact of their obesity on their health. So you're absolutely right about that, and I'm not a fan of any of the diet drugs. That said, actually, we have no data, zero data, that weight loss is health enhancing from a cardiovascular standpoint. There's one randomized control, I know it sounds paradoxical, one randomized controlled trial recently. The Look Ahead, I believe was the acronym, took patients with diabetes, randomized them to a weight loss, weight management strategy, and usual care, and they in fact had a group difference, meaning it was a successful trial for weight management. Most of them are not successful because we don't know how to help people lose weight. And they had absolutely no impact on death, MI, stroke, or any of the intermediate outcomes. So we don't really know how to help people lose weight, but what we do know how to do is we have many intervention trials for physical activity. And number one, we know how to do it. We just have to learn. I mean, you know, practitioners have to learn, and health systems have to figure this out and make it part of their strategy, just like the smoking cessation. And then number two, we need to implement it and help our patients be more physically active. So the new guidelines were commissioned to be living guidelines. We're following the Institute of Medicine's suggestions and what guidelines should look like, how they should be refreshed regularly. And in this digital age, we anticipate that they will be updated sooner rather than later, that the expert consensus groups are formed. There may be some reformulation as time goes on, but that there's just absolutely no reason that these can't be regularly updated as new information emerges.